So I'll just quickly come on to the third and possibly most complicated element of all of this, which is the reforms that we announced more recently in relation to the system for how care and support is funded, and in particular our response to the work of Andrew Dilnot and his commission that took a year and came up with these proposals. You might have seen something about this, you might know more or less about this, undoubtedly you'll have seen something in the media when it was announced. And this is the idea that we will legislate through the bill to create a cap on the amount of someone's lifetime care costs to meet their eligible needs. And this all comes from the idea that social care is almost alone amongst the areas in our lives where we can't insure ourselves against unlimited catastrophic costs. What this graph shows you through that sweeping curve is the amount of lifetime care costs that the average person will have. Whilst lots of people will have very little or none, around about 1 in 10 people will actually rack up care costs of over £150,000 over their lifetime. And the essence of the Dilnot proposal is that the government should set a cap on the highest point of those care costs where it can get to, and then over that level the government should be giving financial support to people to try and help people insure themselves against those catastrophic costs, and also to try and build up an insurance market to help people plan. So that's what we've announced about that. There will be a cap that will initially be set at £72,000 when this is implemented in April 2016. So there'll be a cap on reasonable care costs. There are a few other parts of that that are relevant as well. That cap will be for people aged over 65. People who have adult social care needs when they turn 18 will have a cap set at 0, so they'll never have to pay. Anyone between 18 and 65 will have a lower level cap that will be sort of tapered up to the maximum amount. And alongside that, the principles also extend to changes to the means test and the thresholds for means testing for social care. So that's actually increasing the level of the means test from the current amount, which says that anyone with assets over £23,250 has to pay for all their care. That limit's going to be moved up to £118,000 when it's implemented. So more people will get more support from the local authority. I could talk about that for about the next 3 hours and still not do it justice, so I won't. Just to say that there were other elements of the Dilnot system as well that we're also implementing, some of which I've mentioned. One of those worth pulling out is about a more universal access to a deferred payment scheme, which effectively allows the local authority to defer people's charges until after they die and operate as a bit of a loan facility to help people so they don't have to sell their houses in their lifetime to pay for their care costs. This is a bit of a run through timescales for how some of this is going to be implemented. There's going to be a consultation on all the detailed elements of the new funding system. That'll be launching summertime. We've got a bit of time to get that right, but there are many, many, many complicated things to work out as to how that will work. We'll be looking to introduce the bill around the time of the Queen's speech, although final decisions on the times of that haven't quite been made. And we'll be taking forward all the elements of this over the coming years. Everything in the bill is due to come into force at April 2015, subject to the legislation going through, and the new funding system from a year after that.